Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with WLAE, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's topic, cataracts and cataract surgery, including a relatively new one that is a clearly better choice for some patients. Our guest is ophthalmologist Pulin Shah. Good to have you with us on the program, Doc.
Thanks for having me back.
Yeah, good to always have you here. First, some background to remind you, Dr. Shah received his medical degree from the LSU Medical School in New Orleans. He completed his internship at the University of Hawaii, his ophthalmology residency at the California Pacific Medical Center in San Francisco, and a fellowship in cornea and external disease at the prestigious Bascom Palmer Eye Institute, that's in Miami. He is board certified in ophthalmology and is the medical director of the Ochsner Baptist Laser Vision Center. He also serves on the board of the Southern Eye Bank, and it is our pleasure to welcome Dr. Pulin Shah to Hello Health. Always good to have you on the program. Doctor, remind us how the eye works and how cataracts are formed and what impact they have on our vision.
Sure. Well, the analogy I like to use is a camera. So you can think of your eye as a camera with two lenses. There's two lenses in the front. First lens is on the external part of your eye, that's your cornea. And that helps to focus light into the eye. You also have an internal lens. And the internal lens also helps to focus light to a point on the retina. So just like a camera, there are two lenses, helps to focus light onto your retina. The retina works as kind of like the film of a camera. And then that processes and accepts the image through the optic nerve to your brain. So that's how you see.
What happens with a cataract?
So cataracts affect the internal lens of the eye. So you can't see it necessarily. A lot of people think that it's like a covering over the surface of the eye. But a cataract is actually a darkening or a clouding of the internal lens of the eye. And that's a natural thing that occurs with age. And when that lens clouds up, just like any lens, again, it blocks light, it makes the vision blurry, and it makes it hard to see.
You would think that if either of the lenses is going to cloud up, it's the one that's exposed to the world every day. What is it that causes the internal lens to cloud?
We don't know exactly what causes it, but it's certainly related to age and ultraviolet light. There are some nutritional things that affect it. The cornea, which is our external lens, can certainly be injured, or you can get infections, and those can cause problems as well. But the internal lens of the eye, it ages at a very regular rate, so we know that everybody's going to start to get some kind of age-related cataract eventually, and it's just a buildup of proteins that condense inside that internal lens that creates a cataract.
You mentioned it does impact sight. So what are the symptoms of cataract, and would someone know necessarily that they have one?
Well, it does happen very slowly over time. So often patients come in and they don't realize they've been losing vision for many years until something brings it up, like trying to pass a DMV test, for example, and then they fail and they come in. But the classic symptoms are blurry vision, which can manifest as just difficulty reading, for example, reading the road signs, small things, fine print. A lot of patients complain of glare and halo when they drive at night because of the light scatter that's created from the cataract. So those are the first signs, I guess, and first symptoms of cataract. As the disease progresses, it gets worse and vision just gets cloudy, things become dark, colors are hard to differentiate. And that process continues eventually to the point of blindness, and if it's not taken care of, it can really block the vision completely.
Do the cataracts usually develop at the equal time in both eyes?
Yes, usually it's pretty symmetric. Not always. We often have patients who have one side, but in general, yeah, both eyes do develop at a very slow, kind of regular rate, and you lose vision kind of slowly over time.
Before we get into treating cataracts and how that's done today, including a relatively new procedure, which I know you're excited about, tell me about a service trip recently to Guatemala that you took.
Yeah. So I've actually been involved doing this kind of international work since I was in training, since I was a resident. It's one of the things that attracted me to ophthalmology, actually, being able to pack my instruments in a backpack and go into the mountains somewhere and help blind people see. That was one of the things that brought me to ophthalmology. So I've been doing international work since probably 2005 was the first trip to Guatemala, and that's where we usually go. We have a nonprofit that brings the surgeons and nurses and people together. We go in a team, travel down to Guatemala and stay there for maybe about 10 days, and we operate for 5 or 6 of those days. And it's really an amazing experience. It grounds you, and it makes you realize why you do what you do, because patients do walk in blind, and they walk outside it. It's one of the most rewarding things I do in my career.
You've been on this program numerous times, but if I remember correctly, because maybe not everyone's heard the story, I think usually one of the questions is, Who was it that inspired you to get into medicine? I think you may have met your mentor on one of these trips, right? Who invited you to be a part of this?
Yeah, absolutely. There's a guy I travel with. His name is Justin Stormer Gibson, and he and I met him on one of these trips, and he inspired me to do that, and not only to do it in Guatemala, but also try and bring that service mentality home here and provide, because we certainly have needy people here in New Orleans and everywhere else in America. So bring that kind of mentality here and kind of give back to the community and do some of these free volunteer surgeries that we do in Guatemala all the time, try and bring some of that back here.
So if cataracts are a naturally occurring, age-related, is everyone going to get them, and is everyone going to get them at the same time?
Well, I guess the answer, essentially, yes. Everybody will probably eventually get cataract, but it does happen at different times for different people. Again, it's a natural age-related degeneration that occurs, just like you can get gray hair or wrinkles. Your lens starts to degenerate typically in your 40s, which is why in our 40s we start losing the ability to read up close. We call that presbyopia. Well, that's a hardening of the lens that loses its flexibility compared to when you were younger. So
and no relation to cataracts?
It is actually. It's the same process that's going on. So it starts in your 40s by the lens hardening, but it's still clear, so you can still see through it very well. Just doesn't have the range of vision that you used to have. As that process continues into your 60s, not only does the functionality or the ability to change focus degenerate, but the clarity and the quality degenerates, and that's what we call a cataract. So when it gets to the level of actually blurring your vision and not allowing you to see well, we call it a cataract. And again, as that process continues, not only does it harden and cloud up, but eventually it can turn white. And a mature cataract, the ones kind of like we see in Guatemala, they're often white. And you look in someone's pupil where it should be black, they have a white pupil. And that's a cataract, a mature cataract that's developed way beyond the point where it should have been treated. So
there's no medication for cataracts, right? Surgery is
Yeah, there's no medication that's ever been proven to prevent it or anything. There's certainly research going on to try and find some type of drop to even slow it down a little bit, but nothing yet that we know of that can stop it or prevent it from happening.
Okay, so let's walk us through a cataract surgery. Where does it take place? Is the patient sedated? How do I keep my eye open? Because I know I can't do that on my own. And what instruments are you using? Does it hurt, and how long does it last? I know I've given you a litany of questions, but you got them all.
Yeah, no problem. Well, cataract surgery is an outpatient procedure. It's a pretty quick outpatient procedure. So again, same day stuff. You come in the morning, you get prepared with eye drops and things. You have the surgery done, you go home same day. While you're in surgery, we mostly just use eye drops to numb the eye, so there's really no injections around the eye. We give you an IV to help you relax and some IV medications to make you relax, put you in kind of a twilight, but you're not asleep during this procedure.
You're able to talk to me and I'm able to talk back.
Exactly. We're able to communicate with the patient while we're doing it. The eye's numb, so there's no pain involved. You can tell something's going on, and patients can see colors, and some actually say it's kind of an interesting experience because there's colors flying all over the place like a kaleidoscope.
Without the withdrawal.
Right, exactly.
All right.
And it's pretty quick. Typically, a cataract surgery takes 10 to 15 minutes maximum. So you're sedated, relaxed. You see some lights, you feel some water and pressure, but it's not a scary thing to undergo. Everybody has anxiety about it, of course, but it typically happens pretty quick. And most people, by the time we finish, they say, "Wow, that was it? Like, I'm already done?" And yeah, it usually gets over pretty quick.
How do you keep my eye open? Because I know even though I know it's not going to hurt and it's not going to hurt, and you tell me it's not going to hurt and I'm in a twilight, if I see a laser coming at my eye or whatever it is.
Or even just lights and water.
Yeah, that's right.
So we do use a little speculum. It's a kind of a little retractor, very gentle on the eyelids to hold the eye open. And that's in there for, like I said, about 10 or 15 minutes to keep the eye open. We keep water going on the eye just to keep it moisturized while we're doing that. So that's how we keep it open. As far as people also asking, how do you keep the eye still? Because it moves around a little bit. We don't expect the eye to be perfectly still, so the eye does move a little bit, but we have instruments that hold on to the eye and keep it stabilized. And again, I can talk patients through it and look at the light. There's a bright light that they should be staring at most of the time. So.
Okay. And you said you can drive home that day, but typically, like my mom had cataract surgery, and I drove her home. She didn't drive home, so someone's going to be with you, right?
Yeah, we need somebody with you because there are some IV medications, and you'll be sedated. So we don't want you driving a car yourself that same day. And someone needs to be home, take you home to help make sure you're with it enough to put your drops in and do what you need to do. So, but the very next day, so within 24 hours, once the medications are worn off, patients are able to drive on their own. Typically, they come into the clinic the next day on their own. As long as they're seeing well enough, they can get back to normal activities the very next day.
All right. Well, you know what I think of you. I like you, and you've been on this program many times, so I wanted to impress you. Did a little research. Cataract surgery isn't new, of course. A French ophthalmologist, is that right, performed the first one in 1747, which shocked me. But what's new in the area of cataract surgery?
Yeah, cataract surgery's come a long way, even in the last couple of decades. Even the last decade, it's come along. The two main things that that have happened recently are the use of lasers during the cataract procedure to actually make incisions and dissect the lens. So laser-assisted cataract surgery is one of the biggest advancements in the last 8 years. And the lens technology. So again, when we remove a cataract, we're removing the natural lens from the eye, and we have to replace it. So we have to put an artificial implant in there. So when we implant the lens, there's different types of technologies that actually go on the lens implant itself. And those two things, the laser-assisted cataract surgery, plus new advanced technology lenses, which are designed to help people see without glasses, help have a greater range of vision so that patients can not only see far, but can even read without the need for glasses. So those kind of technologies in the lens implant are really what are exciting about cataract surgery.
All right. You brought along a video to show us, right, of a modern cataract surgery?
Yes. I have a video that shows a little bit of the laser portion as well as the intraoperative portion.
Great. Let's walk us through this, if you would.
Okay. So what you're looking at is the laser portion. So the eye is docked, and there's a fluid filled well that actually sits on top of the eye. The laser will scan the eye, and this is real time. So you're looking at this in real time. So it takes a few seconds for it to scan, and what it's doing right now is it's using what's called an OCT. It's kind of like an ultrasound. But you'll see images of the eye pop up on the right hand of the screen. So there you go. So there's the cornea. Again, that's the outer lens we were talking about, the front of the eye. There now is the lens, your actual internal lens of the eye, and you can see the iris right next to it as well.
That's coming out, right?
Right, that lens is going to come out. And what the machine is doing right now is it's measuring it. It's identifying all the depths and things. It's measuring the size of the pupil. And once those landmarks are identified, now we're going to go through each of the steps that the laser does. The first is a circular opening, we call it capsulotomy, and then an X, that's the fragmentation. You're seeing that happen right now. So that's how quick it happens. Circular opening, then you're going to see a cruciate dissection of the lens happening.
And before we get to that, just want to warn our viewers, the viewers watching at home are not sedated unless they've had a drink or two. So if you get a little queasy seeing a knife, even in this case a laser around an eye, just we'll let you know when you can watch again.
Those last
but anyway,
two little
it is a medical show.
Yeah, and those last two white incisions are astigmatism correcting incisions. So that laser also helps us to correct astigmatism, which is something that prevents people from seeing without glasses. So we've done that laser portion. Now we're in the operating room. And again, the lens has been dissected. You can see the circular opening that was made by the laser. We're using an ultrasound device, that golden instrument there, to suck up and aspirate the lens out. So that happens in a relatively quick fashion, as you can see. There's a second instrument that just helps to move things around as a manipulator. But the ultrasound, we call that phacoemulsification, emulsifying the lens to tiny fragments so it can be removed from a very small incision. And there's fluid flowing in the eye that constantly keep the eye inflated. Once the cataract is removed, again, the new lens is implanted into the bag or the capsule that surrounded your native lens, and that's what holds it in place. And this lens is, again, one of these fancy lenses made of acrylic plastic, but it's got a lot of refractive power. It helps people to see without glasses sometimes. And again, that's where a lot of our new focus, our attention is directed not only at making the surgery safer, but also improving patients' outcomes so there's less dependence on glasses.
Now I'm told there's a robot that will pour you a drink at the bar. Do you think, so obviously your hand is still here, you're still in the surgery, it's not a machine.
Right.
It's not the laser doing the work, is assisting with the work, but you're doing the work.
Right, and that's why we call it laser-assisted cataract surgery. Still requires manual dexterity, still requires us to work in the OR through a microscope. But what the laser does is it makes the incisions that we would make by hand just a little bit more precise. So it's assisting us in doing that. It cuts the lens into fragments, so it makes it easier for us to remove. So it definitely is an aid, and also it can make astigmatic incisions, like I was saying, decreasing your astigmatism, things we used to always do by hand but did not have the precision or the reproducibility that this laser does. So it helps us, and it helps us do our job in a more reliable and sort of way.
What are the results compared to traditional cataract surgery with the laser cataract surgery and these new lenses? And if you want to break that up, feel free to do so.
So, well, first I want people to realize too that, you know, the old way of doing it is still amazing. I mean, our current modern cataract surgery, even without the laser, is pretty phenomenal. The laser does make it just a little bit better, but understand that basic cataract surgery right now, the way we have, you know, all the phacoemulsification technology, it's pretty phenomenal to start. So the incremental improvement is there, and the outcomes that we're seeing are that patients, again, are a little bit less dependent on glasses. The surgery is a little bit quicker. It's a little bit safer. Again, overall statistics aren't that impressive because we start off at such a great, you know, statistical outcome already. We're just improving it just a little bit.
Trying to move from an A to an A+?
Right, that kind of thing. So it's that kind of incremental improvement that we're seeing with the laser-assisted surgery. The big outcomes differences, though, like you said, are from the lens technology that we're having. Because before, you know, at the beginning when we started doing cataract surgeries in this manner, probably until the 1950s or 60s, we didn't put lenses in the eye at all. We would remove the cataract and people would wear very thick glasses. That was the only correction that we had. Well, you know, we developed the first lens implants and they were implanted in probably the 60s. So now people had that power put into their eye. It wasn't very precise, but at least you weren't wearing thick Coke bottle glasses. Now we have such technology and such precision in the lenses that we can say, well, exactly how far do you want to be able to read, you know, after your surgery? Is it here or is it out here? Are you using computers more or are you more of a book reader like this? And we can design your lens implant and choose your lens implant based on your hobbies and your lifestyle. So that's how advanced we are nowadays with these lenses. And again, the thing that patients really like is oftentimes patients have been wearing glasses their whole lives. I mean, Tom, we've done this a couple times. I know you're very nearsighted. And so imagine having cataract surgery one day and then coming out the next day and not needing your contacts anymore, being able to see far and also being able to read the newspaper, which, you know, many of us haven't done in a long time without readers.
Right. My wife was reading something just the other day about turning the clocks ahead or turning the clocks back, and she said she'd like to turn it back to 20 when
Right.
she was 20. Can you get me back there?
So I tell patients not exactly, but it's as close as we can get right now. So when you're young, again, before the lens loses its flexibility, you have a full range of vision. So, you know, you can see from far away to here to here to here, and that increment in between is fluid in the natural human young eye. The lenses have fixed points of focus. So they don't give you a full range throughout the different distances, which is why we try and target the distances that are going to be the most important for your lifestyle. So if you're working more at a computer, we're going to push that reading focus out just a little bit. So we only have really 2 points of focus at this point, but there are, again, new technologies that are evolving, that are under research to give us more of a range, more of a fluid, dynamic, moving kind of lens. We call them accommodating lenses, meaning they can accommodate, they can change focus. So there's definitely still research out there. We haven't hit the holy grail yet, but the technology we have today is pretty good.
Our guest is ophthalmologist Pulin Shah, and tonight we're talking about cataracts and cataract surgery, including the latest cataract surgery, laser cataract surgery, and the newer lenses. Let's go back to the traditional cataract surgery for just a moment. What are the risks associated with the older procedure, and any difference between that procedure and what you're using the laser?
Right. So fortunately, cataract surgery is one of the safest surgeries that we do. Complication rates are probably about 1 in 10,000 for anything serious. So those are pretty good odds. The laser surgery, I think, can improve those odds a little bit, again, incrementally. Not statistically very significant, but it does make the surgery a little bit easier for me to do. And so that translates into, you know, some ease and speed and safety for the patients. But again, cataract surgery is one of the safest surgeries. The complications that we encounter are, the serious ones are very rare, fortunately. Those are things like infections that can happen in any surgery. The more common things are more related to patients' even dissatisfaction. So I get a lot of referrals in from patients who've had cataract surgery that's uncomplicated, but they're just not quite happy with the way they're seeing. Some of it has to do with communication before surgery about what you really should expect and the range of type of vision that patients want. You know, we live in an era right now where patients expect a lot. You know, they expect, and from cataract surgery, patients expect to see all the way down the street, you know, without glasses the very next day. And although that's our goal, we certainly strive to achieve that. But that's not 100% kind of thing. So I think having realistic expectations are important. I think the main issue that a lot of patients have is just that they were expecting more, you know, and we also live in an era where everything's on TV and people are seeing commercials about LASIK vision correction and things, and it's hard for people to differentiate one from the other. So people do expect, you know, laser, they say, you said laser cataract surgery, that means I'm going to see perfectly right immediately. It's not exactly the same thing, so those are different. And so that's kind of one of my greatest challenges is trying to tame people's expectations a little about, you know, the surgery is great and it's safe and it's wonderful and people see better, but sometimes people still need glasses and sometimes your vision is not perfect.
We'll talk about those differences between LASIK and laser in just a moment. If I'm getting both eyes done, because you said in most patients it happens symmetrically, can I get them both done at the same time?
So right now in this country we don't do that. We typically do one eye at a time just for safety reasons, just to make sure that everything goes well with the first eye before we move on to the next one. We typically only wait a couple of weeks between eyes. Rarely we do what we call simultaneous bilateral surgery, which means both eyes at the same time. But it's very rare. It's typically only in patients who for some reason could not get to the operating room twice, or it would be a hardship for them. Patients who have to be put under general anesthesia or have other serious medical problems. If there's a reason to do it, then we sometimes do it, but it's very, very rare.
And the limitations of laser cataract surgery?
The main limitations are, again,
Patient
trying to hit
expectations.
hitting that target every time, you know, because once you start thinking about this laser stuff and the other thing about the laser technology is that it can be expensive. Not all the stuff is covered by insurance, so patients are starting to pay out of pocket for these luxury enhancements to their surgery, these lifestyle enhancements to their surgery, not being able to wear glasses and not needing glasses. Well, those are not necessarily medically covered, so patients are paying a couple $1,000s often out of pocket. And so again, when you're paying that money out of pocket, expectations are much higher. So a lot of my time is talking to patients realistically about what we can achieve, what the range of expectations should be. And that's kind of our focus oftentimes.
You talked about hitting that sweet spot. So give me the sweet spot between people considering LASIK surgery and waiting to get their lenses replaced. So I'd probably be somewhere in that neck of the woods.
Yeah, it's not an absolute cutoff. No, it has to do with age. So
Yeah.
LASIK is a great surgery for young people who wear glasses, especially if you're nearsighted. It's a great procedure because it's minimally invasive. We're not going into the eye. Laser surgery is just, again, there's two lenses we talked about. Laser surgery or LASIK surgery affects the cornea on the outer lens. It's basically like imprinting a contact lens permanently onto the surface of your eye. So it works great for young folks who are nearsighted, but you have to have a clear lens, internal lens, for that to work. So if you're starting to age to the point where your internal lens is not working that well and you're developing early cataract, although we wouldn't call it a cataract yet, it doesn't make a lot of sense to fix the outer lens when the internal lens is degenerating. So exactly when that is for different people, there's not an absolute number. For me, because I do LASIK as well, my general cutoff is in the early 50s. Because by the time you hit your early 50s, if you have LASIK, it's probably not going to last that long. Right? Because like we just said, your lens begins to degenerate and your prescription will start to change. So if you have LASIK at 51, 52, it might not last 4 or 5 years. And so I typically counsel patients away from LASIK at that age and say, if you have a little bit of a cataract, or if you can wait for a couple of years, wait till the lens gets a little bit worse, you'll see a greater improvement. And that surgery will last you forever. Because once we remove your lens and replace it with an artificial implant, that implant is yours forever.
Consider me counseled. Always a pleasure to have you, Doc.
Great.
Thank you.
Nice to see you.
Dr. Pulin Shah. Well, to make an appointment with any Ochsner physician, including tonight's guest, you can call a special number set up just for viewers of this program, and here it is, 504-842-5669. That's 842-5669. Or you can send us questions by email, too. Here's the address, hellohealth@ochsner.org. As a reminder, you can rewatch tonight's presentation or most of our Hello Health programs on our website at WLAE.com. Ochsner's website's got lots of them too at ochsner.org. Thanks again to tonight's guest, Dr. Pulin Shah. Thanks to Humana and Ochsner for making our program possible. And our final thanks, as always, is to you for your support of our program, Hello Health, and our station, WLAE. Good night.